The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
March is Colorectal Cancer Awareness Month, and we have a colon and rectal surgeon joining us now, Dr. Bryce Hawk with Intermountain Healthcare. And Dr. Hawk, colon cancer is what? Not only treatable, but curable?
Yes, it's not only treatable and curable, but also preventable.
And the main thing is to get those screenings.
Exactly.
And colonoscopies aren't that bad. I've had several, and our family is religious about it because we know it can be prevented and it can save lives. Who needs to get a colonoscopy?
So actually, the recommendations for this have recently changed due to younger people having higher rates of these cancers now. So instead of 50 as the age for screening for colorectal cancer, we now recommend starting screening colonoscopies at age 45 for patients that don't have any family history or risk factors. But for patients who do have a family history or risk factors, they may need screenings even earlier, at 40 years old or even earlier if their family members were younger when they were diagnosed with the cancer.
What are the other risk factors?
So family histories of polyps as well as just colorectal cancer, or any known family history of a genetic defect that can be associated with colorectal cancer. Other things that put patients at higher risk include smoking and some dietary factors like eating red meats, but those aren't in our guidelines now for screening those patients earlier. And we also know that race, African Americans have higher rates of being diagnosed with colorectal cancer, although this may be related to decreased screening in that population.
Okay. And how easy is it to set up an appointment and get a colonoscopy to get screened?
So it's really easy, especially for people who don't have major medical issues. You don't need to have an appointment in the clinic with the person doing the colonoscopy beforehand. We just ask you a few questions on the phone, get you scheduled, and then you come in. You do the preparation the day before, come into the endoscopy suite. You'll have a nice nap while we put the camera in and take care of any polyps you have.
That's right. You're done with it. Well, you get a nice little nap, and that's it. So, Dr. Hawk, thanks so much, and urging people to get screened. If you want more information about the screening recommendations, go to intermountainhealthcare.org.
Thank you.